Welcome, everyone. We're glad to be with you today. I'm Jen Rumbolsky, the director of the La Crosse County Health Department, and I'm joined today by Dr. Fitzgerald, who is in family medicine at Mayo Clinic Health System, and Dr. Cogbill, who is in geriatrics at Gunderson Health System. So glad to have them today. We wanted to talk today with you about a number of items. First of all, want to just share with you that the data we're releasing today really does show some promising movement in a good direction. So the overall level of spread of COVID in our community is improving, though just to recognize we remain above the standard that we're looking at, which keeps us in the red, according to the Harvard model. Secondly, I wanted to just identify that we have had a number of deaths reported recently that totals 7 in the last week, so October 5th through the 11th. And the majority, not all, but the majority have been in long-term care scenarios. And we do recognize there's a direct linkage from those cases to the several weeks ago when we had cases really showing up in healthy populations. There is linkage from that kind of scenario to 2 to 4 weeks later, which is for us right now, having an increase in hospitalizations and deaths relating to, particularly we're seeing that in congregate settings, in vulnerable populations with long-term care, where there's a known understanding of higher severity and death risk in those populations. Also, wanted to call out on our CooleyCovid19.org website, for the first time this week, you will see that we are reporting the rate of death because that is a significant number, whereas in the past it has not been a rate of significance to report. So this week you'll see that we report both the new case rate and that death rate so that we are being fully transparent, reporting both of those with the context that I just shared about deaths. So overall, to understand, though we've had 7 in the past week reported deaths, we overall have 14 deaths, of which again, the majority, but not all, have been in long-term care and assisted living facilities. So just a reminder that our behaviors and our choices are important, even if you don't work or have a loved one in long-term care and assisted living. And finally, I just want to remind all of us, as we will likely do throughout this media briefing, that the recommendations that we continue to release from the collaborative are continuing to be very important in order to keep our community and the trend of cases moving in the right direction and prevent further disease, spread of disease, hospitalizations, and deaths. And just noting that cases are coming more from social gatherings, particularly 3 to 4 households or so getting together on social occasions such as birthday parties, family dinners. So we are seeing cases come from those kinds of scenarios. We are also seeing that our case numbers are increasing in the more middle-aged age range as opposed to those younger populations where they have been before. So just a reminder that those recommendations that we put out each week remain very important. And I'll now allow, I believe, Dr. Fitzgerald to speak.
Hi, just wanted to echo what Ms. Rumbolsky said. Again, we have seen a significant rise in the skilled nursing facilities. All of the behavior of our entire community does affect that. The cases that are seen in the skilled nursing facilities and the assisted living facilities come from people who are in the community and come there to work. So all of what we do in our daily lives affects not just what we're seeing in our own homes and our own workplaces, but also beyond that in our community. If you look at what's happened in the hospital over the last few weeks in both healthcare systems, we have seen a slight increase in our inpatient census. This is both regular medical patients and our ICU patients. Both of our healthcare systems are well within our ability to care for those patients. We have not been stretched to raise to any surge level. We're doing just fine in our healthcare facilities right now, even with the increased numbers. We have some ICU patients, we've had some ventilated patients, but our inpatient practices are doing quite well taking care of those people. And again, part of what we look for as far as community risk is our hospital facilities, our healthcare systems being overrun with their ability to care for patients. And right now, I think we're in a pretty good place. both healthcare systems have a good plan to take care of illness as it affects the inpatient part of our practices. And I think we're in a good place with that.
Thank you. And then I would like to have us hear from Dr. Cogbill.
Thank you. Well, first, let me just say, Jen, we are so glad to have you back. We're glad that you're feeling better. And thank you to our local media partners for this opportunity. And we really appreciate your patience and your partnership through all of this. So I don't have a lot to add to what Jen and Dr. Fitzgerald just said. I'll just reiterate the same thing I've been saying for weeks now, which is that we are all woven together as the fabric of this community, and our choices have the potential to have an enormous impact on those around us. And so, you know, again, if we could all just do our best to take care of each other, to wash our hands, to physically distance, to wear our masks, not to congregate, that truly has a ripple effect that is very, very far reaching in our community. And so I would just implore everyone to remember that.
Maybe just a comment to follow up on Dr. Cogbill. I'd like to thank her and her teams, all the staff that's working at these skilled nursing facilities. They've been remarkably challenged. You know, I think the example, you know, when we can get in trouble in all of our healthcare settings, including skilled nursing, assisted living, inpatient, even our outpatient clinics, not only from the illness from the COVID itself, but from those people who are quarantined due to exposures. And our skilled nursing facilities are a really good example of, we had many of the staff that had to quarantine because of an exposure, and it made staffing those facilities very, very difficult. If that same thing happens in our hospital settings, we may not be able to do surgeries and some of those things that are really important to keep people healthy. In our clinic settings, we may have to shift some of our outpatient staff to inpatient setting and not have people get their routine care, which could result in illness not related to COVID. So all of these things have a ripple effect. All of our behaviors affect not only those people who get ill, but those people who have to stay home with quarantines. And that's really important when we look at the community health.
So I think at this time we will allow questions from our media partners.
Hi, Jen. Marcus from News 19. I was wondering how, with the county health department's previous time working together with the Tavern League, what's your guys' response to them challenging Governor Evers' 25% capacity order?
Yeah, I mean, we have, I think, a good relationship. I've spoken with the Tavern League at both the state and the local level, several times. I mean, I think it's something that I don't wish to, you know, comment on in great detail, other than to say we're aware of it, we'll monitor it. You know, I think it's a multifaceted aspect or issue. And, you know, I do just want to call out that what is currently in the state order has been a recommendation from the collaborative for a number of weeks now, which is relating to the capacity percentage or a number, whichever is lower. That's currently what our collaborative recommendations say. And that is tied back directly to science and the fact that we understand that when individuals are in close contact and in closed spaces, particularly, the spread of COVID can happen much more easily. So I would just sort of reorient us to the fact that we have recommendations relating to capacity.
Hey, Jen, this is Rick at WIZM. I don't want to get personal here, but you were off for COVID, so obviously you're doing well. Do you want to share your experience there? I think you were off maybe 6 days.
Yeah, thanks, Rick. I did work because we are working not always in the office. I did work my first couple of days, and then you're right, I was off for a total of 4 business days. But I was fairly sick during my 10-day isolation period. And I'm not the type of person who normally talks about themselves in this way, but I think it's appropriate to recognize what people go through when they have COVID. And I had probably every symptom with the exception of a high fever, and I was pretty out for a number of days in a row. I continue to have some fatigue, but I have been back at work since Monday. I'm glad to be back. When you're out of your structure, it's more difficult, and it can really weigh heavily on your mental health as well. But yeah, glad to be back, and just feel for anybody who goes through COVID symptoms, and knowing how it can vary from individual to individual. It makes me think in great detail about the individuals that are, experiencing very severe symptoms that require hospitalization, or that lose a family member or a loved one to COVID. I think about Dr. Cogbill and her team, and also wish to thank that team for the work that they do. They're really heroes, as well as everyone who's caring for folks with COVID in our community. So yeah, I'm glad to be much improved, not perfect, but on the mend. So thanks for asking, Rick.
We have a question from Emily at the La Crosse Tribune, wondering if we can clarify if all of the case-related deaths at nursing or assisted living facilities were due to infections among staff.
I don't know if Jen, if you or Dr. Cogbill could comment. I think the question is, was those patients who got COVID and then subsequently died from that, was the contact tracing traced back to staff?
I can answer that, Jen, and then you can correct me if it's inaccurate. The brief answer is no, but I can tell you that there, in every facility in which there was a COVID positive resident and a death, there were also positive staff.
I really don't have anything to add to that. I think every scenario can be different, and we have to recognize that in some of these facilities where there is, the residents do not leave the facility, obviously it has to get into that facility, likely through staff. I mean, that's the entry point, but that's not at all to cause any blame. It's just a sort of a reminder to all of us. And like I said earlier in this briefing, even if we don't work in a long-term care facility or an assisted living facility, or we don't have a loved one, that doesn't mean that our behaviors can't connect back to those kinds of outbreaks in those types of facilities where the risk of hospitalization, death, and severe illness is higher.
Rick at Wisdom again. Kind of a little off topic a little bit, but the COVID-19 deaths are kind of, stacking up a little bit. But about the beginning of last month, the La Crosse Police Department talked about drug overdoses, and they said that there was, I believe, 7 drug overdoses in a week, and 5 of those people have died. They reported today that there was a big fentanyl arrest or seizure, they called it today. Drug overdoses, is that a big problem? Is it comparable to COVID in the county right now? Is it a bigger problem? Can you get, I don't, maybe you guys don't have the numbers in front of you, but I think it's something, is it worth something that we need to address as a community?
Yeah, I can speak just briefly to that, Rick. And what I would say is that, we have an Alliance to Heal, a group that is a partnership across La Crosse Community Foundation, Gunderson Health System, Mayo Clinic Health System, and the health department, the county. And, I do know that the number of overdoses and the number of deaths associated with overdoses has been much higher this year than in past years. I am concerned about that. I think we all are. There are some linkages to COVID. Always there would be likelihood of linkages to particular, types of fentanyl, for example, because it is known to increase death from overdose as opposed to being able to recover from an overdose. So, I can only speak at that level at this point, but certainly we have partnerships of folks working on that topic because it is a concern for our community.
I would just follow up and echo that. I think we have seen increasing issues with narcotic overdoses, substance abuse in general. I think it has to do with, COVID and with, just the general discourse in our society. We're seeing a lot of mental health illness issues. This is really crosses all sections of society, especially has been prevalent, I'm hearing from my child psychologist, in our younger population. The isolation and the lack of support from our K through 12 schools because of the risk, not necessarily the fault of any of those districts. It really has isolated some of these people, and that's really causing some mental health issues. So again, it's all part of the issue with COVID. We'll get through this at some point, but those are other kind of spin-off issues that we need to be aware of.
And I'm certainly not an expert, but you know, in COVID times, there are a lot of pressures, and there are a lot of aspects, not just the having the illness yourself, but a lot of things come into play that can make it really difficult for us to process and understand, you know, what this means for us and where is the light at the end of the tunnel. So I think it does remind us that we still have to have connections with others, even if that connection cannot be face to face in close contact. It is a different type of connection, and we have to make that shift. But we have many positives, including technology like this, to be able to make those connections. And we have to, you know, we have to reach out if we need help. I mean, that is always something we need to remind. It is not that there is no stigma relating to, you know, asking for help, and developing connections that are safe in COVID times.
Both healthcare systems have readily available virtual care. So again, if people are, you know, both systems are able to care for really any medical care you need. If you need help, come in and see us. If you're uncomfortable with that, there are virtual options, and that's true of in the behavioral health world, really with any other medical issues. So we're happy to take care of our patients in any setting, whatever they would choose.
We have a question from Chuck at WKBT. What is being done to protect those who are not sick in these facilities but risk exposure?
So I can speak to that. You know, these facilities have been preparing for an outbreak and managing outbreaks since March. And as we've said before in these briefings, we've been so fortunate up until this fall to really not have many outbreaks, certainly no widespread outbreaks and no deaths up until the past few weeks. But that doesn't mean that they haven't been preparing for the inevitability of COVID entering into a nursing home or an assisted living. So our facilities all wear full PPE, the staff does, full personal protective equipment to protect the vulnerable people who live there from getting COVID. They have, for the most part, halted visitors, which family members and others who want to come and visit their loved one who resides in a facility. Obviously, that has its own really difficult side effects related to it. We're going on many months now in which these people have not seen their families. They haven't had a chance to connect, to hug, to see each other, to hold their hands. And that's difficult, but the purpose behind that is to prevent transmission. All of our facilities also work very, very closely with the county. They work very closely with the state and with CMS, our federal government, to adhere to the guidelines that have been set forth for them. And I will add as well, we really have a nice collaborative partnership on our long-term care task force. It's Mayo, Gunderson, and the county, and all of these facilities. We meet weekly, we brainstorm with each other. And what's really been born of this is a very collegial supportive relationship among all of the facilities and these partners, reaching out and supporting each other when one is in an outbreak status. So, and I guess along those lines, I'm not sure I have the words to describe how hard the staff are working in facilities to protect these residents. They really are like family to each other, and it's very personal for them, for the staff and for the residents. And so they are putting just immense efforts into taking care of those people who reside in these facilities. So yeah, they really are the frontline workers. They are the heroes in all of this, putting like I said, immense effort into preventing COVID from getting into the building in the first place. And if it does, preventing its spread as much as possible.
We've seen videos on social media of packed dance floors and bars in downtown La Crosse, with the capacity recommendation being 25% total. How does the collaborative plan to move forward in preventing gatherings like this?
So Marcus, I would really pull that away from the collaborative, and I would say that we have been doing a lot of work in the past couple of weeks from the county side with the health department. Again, the confusion initially, even recently about the authority. I do just want to identify that we are, we do have the ability to write individual business orders And, I think that the state order, we did act in one instance already. And so we are moving towards more, more enforcement along those lines. And more will likely come out soon relating to that topic. But, we always want this to be relating to education, and will continuously encourage those businesses to do the right thing. 25% has been the recommendation now for weeks. And they can help us reduce the spread of this virus. And if that will not happen voluntarily, then we are moving towards enforcement action.
And maybe a comment, again, I think the questions are appropriate for, reception halls and bars and taverns. I don't want to pick on them individually. There's no higher risk in a bar or tavern with 100 people than there is in someone's home or at a reception or at a racetrack. It's gatherings of people who are not wearing PPE and are not distancing. Again, you may say taverns are part of that. I would agree, but they're not the only ones. There's many parts of our community, and really in the private sector, where some of the gatherings really aren't following the recommendations, and all of those kind of share equally high risk.
And while we've been saying this for months, I think it's appropriate to share it again, that if we were routinely trying our very best to follow the recommendations and guidelines, the spread of COVID would be greatly reduced in our community. We all have the power to take that action for ourselves, to protect our families, our loved ones, and our community. Those have not changed significantly. Even in the past several weeks, they've remained fairly consistent, and that should be telling, in that, there really are a set of specific actions that can greatly decrease the spread of this virus.
And our community is doing better. We were, the areas over by Green Bay and Sheboygan and some of those areas are really struggling right now, and to the point where their hospital systems are being overrun and they're having some real issues caring for patients. We were at that level of risk not too many weeks ago, and I think there have been some behaviors that have changed in our community that have allowed us to show some improvement. And I really would commend, some of the higher learning centers, UWL, Viterbo, WWTC, those students, the faculty. They've changed behavior such that if you look at the demographics of the positive tests, those kind of 18 to 30 positives have really come in line with the rest of the demographics. And, so those institutions should be patted on the back. They've done a good job of kind of adjusting behavior, and you can see that it works.
Rick again at Wisdom. I'll stick with this topic. I have another question, but I can ask it in a minute. In reference to that, our community seems to be doing better. I think the state had another 3,000 cases. I think a state really high up there in deaths, 28 deaths, which is near a record high. And hospitalizations was at a record high today. The state just released those numbers. Why is our community doing better than the rest? Is that surprising? I guess is more the better question. Is it surprising that our community is doing better than the rest when the state numbers come up so high like that?
Well, I'll start and then you guys can join in. I think it's important to remember that with COVID, we have ups and downs. So you're going to have peaks and valleys in case numbers and trends over time. This is going to go on until we have a vaccine that is effective to greatly reduce the spread of COVID. So I don't know that there's a definitive answer, but whenever I would like to believe that our recent case rates several weeks ago resulted in significant conversations amongst partners in our community. And I think to Dr. Fitzgerald's point, we have seen some improvements locally in order to reduce some of those. It's always hard to tie it directly, each action to the reaction, but I think there has been impact there. And we also know that there's a known documented trend that when you see case rates in healthy populations be really high 2 to 4 weeks later, it's very likely you're going to see the hospitalization and deaths occur in vulnerable populations like long-term care facilities. So I think that's probably what's also happening with the death numbers at the state. I mean, we're seeing that happen locally. I think it makes sense that that is what's happening at the state level as well.
Yeah, and I would just, again, repeat that this is going to sound like a broken record, but again, a lot of this is due to the hard work of Dr. Cogbill and her teams. They've done a really good job in some of these facilities. They've, mitigated the risk as best they can. There's been testing within our skilled nursing facilities to help staff, identify those asymptomatic people that may bring it into a facility. And I think that has really helped our hospital numbers and certainly has helped the amount of deaths we've had from COVID in our community. We've had more than we care for. There's still more people sick in some of those facilities than we care for, but her team has done remarkably good work.
Well, thank you. I appreciate that. And I should tell you, this is very personal for me. This has been a hard week. This has been a hard couple of weeks for my team, and our experience pales in comparison to the experience of the people in our facilities who are suffering from COVID and their families who can't be with them at this time. And but I guess if I could just take a moment to say, the reason that this work in the long-term care facilities has been, I hesitate to use the word successful, but I mean, the reason that we have been able to manage people in place when they want to stay in their home, which is in the facility, is because we have such a robust support system with a collaborative support system with Mayo, with Gunderson, and with the county. I mean, it truly is all of us together at the table with the facility when there is an outbreak, brainstorming what are the clinical needs of the residents and the patients, what are the families' needs, what can public health do to support us, what can the healthcare systems do to support us. And we talk every single day with our hospitalist partners, and we talk every day with the county and the facility and our team. And so it is a remarkable partnership, and our ultimate goal really, obviously, it's to stop the spread of COVID, and it's to do as much as we can to prevent a death or other outcomes. But when it really boils down to it, we want to honor and respect the choices and the wishes of the residents in these facilities who have COVID, and we engage them in those conversations. And many of them and their families say, we want to be managed in place. A hospital transfer is not what we want. If you can give us that medication at the facility, if we can have our labs drawn here or get IV fluids here instead of going to the hospital, could we please make that happen? And so part of what I think is so successful, again, I'm sorry for the use of that word, I can't find another one, but what's so successful about this team is that we engage early in those conversations with our patients, with our families, with our facilities, and we have this really wonderful support from our healthcare partners and from the county in all of this work.
Rick again. Is a metric like new hospitalized something that would be worth sharing on the collaborative dashboard? I know we do weekly case total, maybe something like that, the past week's case total where we're at. Is something like a weekly hospitalized? I know we do that rate, but it's only updated once a week. Is that important? Or I think a lot of people get worried about hospitalization or being hospitalized from COVID, whether they're older or younger, because not everyone has great health insurance with a low deductible.
Yeah, I know both healthcare systems look at that internally. I know at Mayo, not only do I keep track of my internal admissions and then kind of the daily census, but also we get a feel of where things are throughout the Midwest, whether it's Rochester, Eau Claire, or the rest of the places we're having the health system. I think we can talk about that with the collaborative to see if that would be a useful metric to kind of be part of what we put out there. We've been trying not to be specific about that and more just have the health systems give us kind of a green, yellow, red light status on how the healthcare facilities are, but we're open to, adjusting what we report if that's the need of the community.
What's the connection between, with healthcare capacity, the new hospital rate being at caution, but then the care capacity is at satisfactory?
Now, some of that speaks to our ability to not only care for those patients when they're in the hospital, but actually discharge them, to a safe environment where they have care at home. I can speak to our healthcare system. We have a virtual offering for all COVID positive patients where they're part of a virtual care team that's staffed by the infectious disease department in Rochester. They're contacted daily through virtual care, and they have to report out vitals, and we touch base with them regularly. I think Henderson does similarly. Some of what we run into, though, and those patients that are admitted to the hospital, especially if they're coming from a skilled nursing facility, sometimes it's hard to get them back. There's rules that CMS puts on some of our skilled nursing facilities about when it's acceptable to accept patients back into their facilities. And again, there's rules from CMS that they have to do reviews when some of these cases come up, and that complicates things. So even if you look at the CDC recommendations for when it's appropriate for someone like Jen to come back to work after an illness, that may not be the same rules that apply to when someone could go back to their home facility. And so they stay in the hospital for quite a long time.
All right, last one. The La Crosse School District is they're pushing back their opening date for in-class learning, or however you want to describe that. I think it's October 25th now, and maybe they're going to update that again today. And I know they kind of went with their own dashboard. I think they used the same model, the Harvard model. But is there any indication that La Crosse's school district will be in-person learning soon, as the cases seem to be coming down?
So as you may know, Rick, we meet weekly, not just with the core collaborative members, but also with key stakeholders, and public and private schools, K through 12, are part of that. You're right that they have a set of tools that they're looking at the data we put out each week. It's encouraging to them and to us to see that our new case rate is trending in a good direction. And I think they will use that data to determine whether or not they will be back in school in person and when. So I believe that some of those decisions will be made soon, but I can't speak to the school's decisions. That is really their local decision.
Yeah, I think, Aaron Engel, Dr. Engel, is one of the people we speak to every week, and he's doing a really good job of, staying on top of this and doing the best he can to educate his students and really keep his staff safe. It's a really important question. If you look at some of the recommendations that have come out, really they're encouraging all of us to do the best we can to get these kids back into school. The K through 12 population is a really at-risk population. There's study after study that shows that in-person education is by far superior. Now, that being said, you have to do it in a safe manner. And you can't, I think what the superintendents would tell you is part of what really would be hard for them is to have kind of fits and starts when it comes to this, and be open for a week and then closed for a week. And it's really hard for parents in the community. It's hard for the continuity of their faculty, and it's hard for the students to kind of get into a rhythm of how they're going to learn. But again, it is a priority to get those students back into school, because it really is, if you look at what's essential to our community, I think healthcare is essential. I think grocery stores being open so we can have food is essential. Pharmacies so we can get medicine are essential. But educating our kids is really amongst those things that are essential. And, I spoke to Mr. Reber and Aaron Engel regularly. They're doing a really good job with this. They're doing the best they can for the kids. They really want to do what they can to get these kids back into class, but you have to do it in a safe manner.
I think we have time for one more media question today.
Yeah, I guess maybe I should just kind of rephrase my question, but how can the new hospital rate be at caution, but then the care capacity rate be at satisfactory?
Yeah, I think what you look at when it comes to, so that new hospitalization rate is especially when we had that little bit of a surge over the last 2 weeks, we did see an increase in the number of patients that were admitted, but we did not approach where our hospitals were at capacity to care for those patients. So typically when this began in March, even with the small surge that we saw back in June, and then this larger surge more recently, typically the inpatients in our facility would have been less than 10. It increased beyond that over the past couple of weeks, including some of those patients that needed to be cared for in an intensive care unit. but at no time were we close to the capacity to care for those patients. So we had plenty of staff, we had plenty of rooms and facilities, we have plenty of ventilators and equipment and PPE and all those things that are vital to care for patients who are moderate to severely ill. And I think if you look at places like New York City that really struggled with the capacity to care for severely ill patients, it was the shortages of ventilators and staff and really the actual rooms and facilities that caused the crisis really early on in this. And we've not reached that or even approached that.
I think that's all we have for media questions, Jen.
Thank you. So on behalf of all three of us, Dr. Cogbill, Dr. Fitzgerald, and myself, and Colleen, who's doing our great work for our those that have hearing impairment and deaf and hard of hearing. Thank you so much. We appreciate you being with us today. I do just want to call briefly your attention to the COVID-19.org website where our data will be updated. The case data page there has some new nice features to it where you can sort data differently. You can see municipality level data by date now. So just if you're interested in that level of data, there have been some improvements to the site. And again, on behalf of all of us, we appreciate you being with us today and hope you have a good, safe rest of your week.
Thank you.